Hi, my name is Amanda Newland, and this is my final oral presentation for technical communications. Today, I'm going to be discussing my project proposal, which was the implementation of the artificial pancreas and why I think that that's important. So if we take a look at the agenda, first I'm going to discuss type 1 diabetes and the potential ramifications associated with that disease. Next, I'm going to cover the solution, which is the artificial pancreas. Then we'll discuss the budget. I'll give a concluding statement, and then I'll leave some room for questions from you guys. So before we get started, I just wanted to touch on the difference between type 1 and type 2 diabetes. Type 2 diabetes can result from many risk factors, including obesity, high caloric intake, poor diet, and infrequent exercise. But the difference between this disease and type 1 diabetes is that medical intervention, or pharmacological intervention for that matter, may not be necessary to manage the disease process. If someone is dedicated to changing their diet, exercising more frequently and losing weight, the disease can be managed that way. But for somebody who suffers from type 1 diabetes, which is also called juvenile diabetes because of the fact that it's diagnosed so young in life, it needs to be managed medically because the pancreas itself is malfunctioning and cannot create insulin. This can result from, congenital defects or some sort of trauma such as a car accident that can also lead to a malfunctioning pancreas. So this artificial pancreas is designed specifically for type 1 diabetics because of the extensive medical interventions necessary to treat their disease process. I just wanted to give that little bit of background before we delve in. So here we go. The first potential ramification associated with diabetes of any kind is poor skin integrity. So when tissue is exposed to high levels of glucose for a continuous amount of time, the tissue can become ischemic and also necrotic. And injuries that diabetics sustain are less likely to heal properly. According to the American Diabetic Association, the risk for injury for diabetics is so huge just because the skin is so full of glucose that it can't synthesize protein, so there's no healing going on. The next potential ramification, which piggybacks along with poor skin integrity, is the risk for infection, which is huge with diabetics. According to the Indian Journal of Endocrinology and Metabolism, hyperglycemic environments favor immune dysfunction. It's well known for those in the medical community that bacteria thrives off of sugar, and since glucose is sugar, it would make sense that the diabetic environment would be the perfect breeding ground for any type of bacteria that requires glucose for survival. And foot infections are huge. They are the biggest, risk for injury, obviously, but also they're the biggest cause of hospitalization in diabetics. And it doesn't, it's not a purposeful injury. I mean, none of them usually are, but it can be something so minor, such as bumping a toe or, an ingrown toenail, which wouldn't necessarily be an issue for anybody who doesn't have diabetes, but for a diabetic, it can be life-threatening. Next, cerebrovascular disease is huge. Usually people who have diabetes suffer from hypertension, not necessarily so, but the two are usually, hand in hand. And the risk for stroke for someone who has diabetes is 2 to 4 times higher than someone without the disease process. Hyperglycemia and hypertension are just risk factors for stroke. So minimizing these ramifications associated with diabetes is huge. And not to mention the fact that these people with type 1 diabetes, they need these medical interventions. They can't just, like I said earlier, change their diet or exercise more frequently, That won't have any effect on the disease process itself. So it's really important to identify these potential complications so that way we know what we can and cannot fix with medical intervention. So moving on to the solution itself, the artificial pancreas. Boston University actually is the head runner for this. They call it the bionic pancreas. I've heard it under different pseudonyms like artificial, but they are the head runners for this program, and they're making so much leeway right now. They're attempting to have their project proposal submitted to the FDA by 2017, and they've started clinical trials on humans in a controlled environment, obviously, but the data that they've gotten so far is pretty substantial, leaning towards that this would be a great medical innovation for those suffering from type 1 diabetes. The great thing about this is, if designed properly and according to Boston University's, along with my research, this would substitute for the lack of a real pancreas, because there's continuous monitoring and adjusting of blood glucose levels. Insulin pumps now are just that, insulin pumps. They monitor the blood glucose level and they administer insulin as needed, but the great thing about this bionic or artificial pancreas is the fact that not only would it administer insulin, but it could administer glucagon, which is a hormone secreted in the body to raise glucose levels, which is amazing, in my opinion, that we could have a device that could do both. And then diabetics there's no finger sticks, there's no, I need to eat a certain amount of calories before I exercise, or, planning out their day. They would have a life back, like, someone without diabetes. And this is a very long-term solution to a chronic disease, because diabetes is just that, a chronic disease, especially type 1, because it's never going away. Like I said, no matter changing the diet, exercise, it doesn't matter for these patients with type 1 diabetes. So if we could get something that minimizes, the use of other unnecessary medical interventions, why wouldn't this be a great idea? So yes, the continuous wireless glucose monitor. When I was looking at Boston University's data, they essentially hitched up it looked like an insulin pump, but it has the capability of wirelessly transmitting through Bluetooth to an iPhone or other portable device. They used the iPhone just because they already have an Apple app that is in use for this particular program. And so this device, it monitors blood glucose and insulin levels continuously. And I think it was an interval of every 5 minutes, and it would send this information out to the physician who had the portable iPhone. And, via Bluetooth, they could just check the lab values at any given time, 24/7, 365 days a year, which is amazing. So just hitching up the iPhone, which is such a not a simple device, don't get me wrong, it is a very intelligent mini computer, but something that everyone uses so frequently, and being able to use everyday technology for something as, life-sustaining as this is incredible. And then the glucose and insulin pumps themselves, they would just be attached subcutaneously to the person. They haven't had any adverse effects other than a little bit of hypoglycemia, but there wasn't any infection or anything with the pumps, suggesting that the surgeons who implant them, they have gotten the education that they need to implant these successfully without complication, which is astounding. So moving on to the budget. This was kind of difficult to find just because this is in clinical trials right now. So there's like the preclinical data that is available. So there's a few adjustments I tried to make depending on, fluctuation of price after, marketing. But just to start off with, the iPhone, roughly $800 if you're going to buy it brand new. Not that hefty. I mean, that would be $800 per physician that needs the iPhone. But $800 just for one to start with. The insulin and glucose pumps and hardware said that in the preclinical trials it was $90,000, between $85,000 and $90,000, and they said that after the fact, when they were going to actually manufacture these devices, it would probably bump up to $93,000. That's including the app from Apple, so fluctuation, there probably will be some, especially with the market today, but additionally, that $93,000 was that total. For personnel, this was a little bit trickier to try to figure out where, how much money was going to be needed for this. You're talking engineers to design this, physicians to use this, surgeons to implant this. I probably lowballed, but I chose $300,000 as the personnel cost, and I estimated that as just for like the 1 year time of thing. Hopefully after this goes to the FDA and gets approval, the mass production of these devices hopefully will lower the price a little bit because they won't be as in demand. And there hasn't really been talk too much about insurance companies covering these costs, so hopefully that enters into the equation. That way people who are suffering, from type 1 diabetes, who don't have the best health care, or health care at all, which shouldn't be the case because of Obamacare, but needless to say, there are still people who don't have great health care. So hopefully this will be a cost-effective solution to helping those with type 1 diabetes and not just those who can afford it type of situation. And then also for the insulin and then glucagon medications themselves, insulin is, fairly inexpensive because it's used so much. Glucagon, on the other hand, not really used as much. So I estimated the cost of that per year as $50,000, bringing us to a grand total of $443,800, which seems like a lot, but if you're going to add up the cost of hospitalizations associated with the ramifications I discussed earlier, poor skin integrity, infection, and I'm drawing a blank, I'm sorry, excuse me, cerebrovascular disease, sorry. People being hospitalized for this, that's not cheap, regardless of if they have health insurance or not. So I really think that this would be a cost-effective way to treat type 1 diabetes lifelong, not just manage day-to-day symptoms or, as needed with different parts of the disease process. I think this would be so much more effective and give people their lives back, essentially. So moving on to my conclusion. Like I said, this should be more efficient at managing the disease than finger sticks, insulin pumps, people having to plan out their day to a T to make sure that they don't become hyper or hypoglycemic. These people can't even exercise without planning out, okay, I need to eat, so many carbs before I go exercise, or, okay, well, I know I'm going to be doing this today, so I need to eat X, Y, and Z. That's very not only time-consuming, but exhausting emotionally and physically. I know myself, personally, I don't like to have to plan out what I'm going to eat for the day, and as a nursing student, some of the times I don't get to eat during the day, so it's fortunate that I don't have diabetes, because that's just an extra thing added on to the tasks of the day that most people don't have time for. Nobody plans out their day this well except for those suffering from chronic diseases, and I feel like it's unnecessary. If we have the technology, which we're moving towards that direction, if we have the technology to improve their lives, why would we wait? This would just allow them to have a more normal life, like I've been saying. They can go to the beach, they can go shopping and not have to worry about, okay, well, am I going to have a hypoglycemic reaction today? And also, like I discussed before, these potential ramifications with diabetes drastically reduced. I'm not saying that they would be absent, but if someone has this pump and can have a regulated glucose and insulin level all the time, 24/7, there wouldn't be an excess amount of glucose in the skin So that would mean decreased risk for infection, decreased risk for skin tears or poor skin integrity, and it would also decrease their risk for hypertension, which would decrease the risk for cerebrovascular disease. So all good things associated with this bionic or artificial pancreas, which I think is astounding. So at this point, I would like to ask if any of you have any questions for me that I didn't address in this oral presentation. And if not, I hope I did a good job explaining why this is so important and why I feel so passionately about it the way that I do. Coming from a nursing student, I can't think of any other way to show how much I care about my patients than to research ways in which to better their lives. I think that's a continuing theme for all nurses, and as it should be. Not just nurses, anybody in the healthcare field. But anyway, that was my presentation, and thank you for watching.